And good evening once again. Day 204 of the Biden administration. Millions of Americans may soon be eligible for a third shot to boost their immunity. NBC News among those reporting the FDA is expected to green-light booster shots for immunocompromised people at first, as soon as the next 48 hours. Today, the CDC took a step to endorse vaccines for pregnant women, citing new data finding no increased risk of miscarriage. This comes amid more vaccine mandates. Employees of Amtrak, for one, were the latest to learn today they've got to get the shot or submit to weekly testing on the job. Same now goes for all staff working in California's schools. Governor Gavin Newsom is the first state leader to put such a requirement into place.
We think this is the right thing to do, and we think this is a sustainable way to keeping our schools open and to address the number one anxiety that parents like myself have. I have 4 young children, and that is knowing that the schools are doing everything in their power to keep our kids safe.
Michael, indeed, because of the news tonight, I'd like to begin with you. During the simpler days of our single-strain, uncontrolled pandemic, we made it a habit on this broadcast of asking you what inning we were in the fight. Those were the days before vaccines. And I'm tempted to ask tonight, have they added on innings in the game, or do we find ourselves perhaps in game one of a doubleheader?
Well, I guess I would take it even a slightly different direction than that, Brian. I gave up on innings, and I'm now into quarters, which minute of the quarter it is, because we really had game changers when these new variants arrived. And they have fundamentally changed the game that we're playing. So from my perspective right now, it's all about the variant. It's about what Delta is doing, what it's going to continue to do, and what we can do about it.
I know of your concerns to get the rest of the world vaccinated, and I think all good-hearted Americans agree with you. But are all Americans headed for a third shot sooner rather than later, not just the immunocompromised?
Well, one of the things we have to remember here as we talk about these vaccines, because I hear many people say, oh, my, we didn't know that about the vaccines. We knew from the very beginning we would live in a world that we call corrected science. You know, scientists make discoveries. We then change what we're doing based on that discovery. We then have more discoveries. We again make changes. And in this case, what you're hearing about tonight from the FDA is not really a booster shot, although it's being characterized as that. Remember, for many childhood vaccines, we have 3 to 4 doses of the vaccine to be given before we consider them fully vaccinated. And we now know with immune-compromised people that it's going to take 3 doses to get them to a point that we want them to be at. But then as we move forward, I think you're going to find that over the course of the next several weeks, you're going to hear a lot more about waning immunity, that in fact that people who are beyond 6 months of after their vaccination end up looking like they may need another booster shot. And that's got to be balanced against the fact that right now among the 6.4 billion people living in low and middle income countries, less than 2% of those people have had access to vaccine. If we want to approach this from a humanitarian standpoint, which I think we should, obviously we need to do a lot more. But even more importantly, we need to approach it from a strategic standpoint. And what I mean by that is that this is where the new variants are going to come spinning out of. All those 6.4 billion people who are getting infected and getting infected frequently now. And so I think we're going to have to balance somehow. How do we look at 3 doses to a person in a high-income country like the United States and no doses to the vast majority of the world?